So good afternoon, everyone. Welcome to the Committee on Education and Cultural Affairs. We have a public hearing for two bills that we're going to hear simultaneously, which is LD 798, an act to protect Maine children and students from preventable diseases by repealing certain exemptions from the laws governing immunization requirements, and LD 987, an act to provide autonomy for healthcare providers to practice patient-centered care by amending the laws governing medical exemptions to immunization requirements. Before we get into the public hearings, however, I'm going to first start with the committee members introducing themselves, and I'll start to my right this afternoon.
Thank you, Madam Chair, and thanks everybody for coming today. I'm Gary Drinkwater, District 121, which is Elton, Argyle Township, Corinth, Hudson, and my hometown of Milford. And again, thank you for coming.
Good afternoon. My name is Jan Dodge. I represent House District 97, Belfast, Northport, and Waldo. Thank you for being here today.
Yes, good afternoon. I'm Representative Dave McRae. I live in Fort Fairfield up in the county. That's where I represent, and it looks like you guys represent everywhere else.
Hello and welcome. I'm Brownie Carson, represent State Senate District 24, Brunswick, Freeport, Harpswell, North Yarmouth, and Pownell.
Good afternoon. Great to see everyone and all of those in the overflow rooms. I'm Representative Heidi Sampson, representing House District 21. That's Alfred, Limerick, Shapley, Newfield, and Parsonsfield.
Good afternoon. Welcome, everybody. My name is Representative Henry Ingwerson. I represent House District 10, Arundel, Dayton, and part of Lyman.
Good afternoon, everyone. I'm Shelley Rudnicki. I represent House District 108, which is Fairfield, Mercer, and Smithfield.
Good afternoon. I'm Dick Farnsworth. I represent House District 37, pardon me, which is a part of Portland. And all I can say is this is what democracy looks like.
How's it going? Senator Matt Pouliot. I represent Senate District 15, Augusta, China, Oakland City, and Vassalboro. Thank you all for coming today.
How do you do? I'm Tori Cornfield. I represent House District 125, which is part of Bangor.
And I'm Rebecca Millette. I represent Senate District 29, which is South Portland, Cape Elizabeth, and part of Scarborough. We are assisted today by our committee clerk, Jane Deneen. Any communications that you want to come to the committee, please see Jane, and she will make sure that we get it. Please do not approach the horseshoe. Okay, you can go over and give your materials to Jane, and then you can go to the podium. We'd like to remind everybody to turn off your electronic devices, make sure they're on silence, and that is as much to myself and committee members as it is to anyone else in this room. No eating or drinking by the public except water, and our committee analyst is Karen Netto. She is the one who helps summarize all the information that we are about to hear in these public hearings, and then comes back to us for the work session to provide the information that we've heard and help us provide any information for any questions that we might have asked for in the public hearing. Each person testifying shall announce his or her name, residence, prior to testifying. Now, I would include if there's an affiliation with an organization, to please include that as well. The person, all of you have already signed in, but if you haven't, please make sure to sign in. Legislators and persons in the audience must be addressed by their title. All written materials presented to the committee must bear the name, address, and affiliation, if applicable, of the presenter and the date presented, and persons submitting written material shall provide the committee clerk with at least 20 copies. All questions must be addressed through the chair. The chair may limit testimony at the public hearings, and as you see, we have a clock before us. We try not to use this in our public hearings, but on a bill of this nature, we will not conclude until probably next week if we allowed folks to go on. So we are going to strictly follow this clock. You are going to notice, however, that we don't do this for everybody, the sponsor and co-sponsors of the bill. Okay? Committee members may question witnesses to clarify testimony and to elicit helpful and pertinent information. While probing questions may sometimes be appropriate, members shall show respect at all times for the witnesses and for one another. Members shall refrain from questioning that is argumentative, oppressive, repetitive, or unnecessarily embarrassing to hearing participants. Advocacy and discussion among members are not appropriate at public hearings. A committee member who is the primary sponsor of a legislative document and any member who testifies for or against the legislative document ordinarily should refrain from questioning other witnesses. Okay, the other thing I would like to tell you is that we're going to rotate through. Typically, we go those who are for, those who are against, and those who are neither for nor against. But again, recognizing how many people are here, we're going to rotate through that. We're going to take 10 that are for, 10 that are against, and then 10 that are neither for nor against. Representative Cornfield.
And I'd like you all to remember that every single person in this room and in all the overflow room cares about children.
I also need to let you know that all persons testifying at this public hearing today, the hearing is being broadcast throughout the building and on the internet, and may be heard or recorded by persons listening online. In addition, written testimony provided at the public hearing will be distributed to each member of the committee and will be posted on the legislature's website for viewing by all and any interested parties. So please be mindful that your testimony is public and will be available online. So with that, now open the public hearings officially, and I would call to the podium Claire Holman.
No, Representative.
I'm so sorry. How about the sponsor? That would be good.
Not wearing a name tag. It could be.
Who are you?
Good afternoon, Senator Millett, Representative Cornfield, esteemed members of the Joint Standing Committee on Education and Cultural Affairs. My name is Ryan Tipping. I have the honor of representing most of the wonderful residents of Orono in the House, District 123. I'm here to present LD 798, an act to protect Maine children and students from preventable diseases by repealing certain exemptions from the laws governing immunization requirements. Senators, representatives, please imagine that you're in a boat. The boat is leaking, and it's almost filled with water. It would make sense that we would all want to grab our bail buckets and work to keep it afloat. And if, after much hard work, the boat is nearly dry, you could forgive some of us for relaxing a bit. Some might even set aside the bailing buckets, but sure enough, the leak will eventually overtake us if we become complacent. There's a reason the Centers for Disease Control use this metaphor of a leaky boat to represent a community taking on the struggle of fighting infectious disease. It's a reminder that when our foe is a dangerous, intangible entity capable of putting our children's lives at risk, we are in this together. The actions we take as individuals affect the lives of our neighbors. In this metaphor, the ultimate solution is to plug the hole. In reality, this can only happen when we work together as a society to raise our immunity threshold to the point where a disease cannot take root, and then keep it at that level until there is no source of that disease left to defend against. We have been successful in the past at achieving this goal, most notably with smallpox. But what we are seeing now is a rising tide of diseases that previous generations worked tirelessly to defeat. In my work on this bill, I have come to realize that there is a generational divide. When I talk to some of my peers about whooping cough or measles, some stare blankly, some shrug, and I've even had others try to convince me that these diseases are now harmless. When I discuss the same topic with people who have, and I chose these words carefully, earned the wisdom that only comes with experience, I get a very different reaction. You will likely hear some of these stories today, like what it felt to hold an infant unsuccessfully gasping for air while in the throes of pertussis, or what it was like to take care of a family member who was paralyzed by polio. I think it is safe to say that a growing number of people, despite the considerable education campaigns and widespread access to public health, may not see the value in continuing to bail out our little boat. I think it is also safe to say that the risk is much more dangerous than getting our feet wet. We have all seen the news reports from across the country over the last few months, from Clark County, Washington, to New York City, to Texas, to California. Measles is returning in staggering numbers. Whether it's because of misinformation, fear, indecision, people have withdrawn from the public effort to keep our communities floating high enough within acceptable immunity percentages to avoid catastrophe. Members of the committee, the bill before you is an attempt to reverse this trend and ensure that now and into the future, our schools and daycares will be places where children can learn and grow without fear of serious, harmful, preventable diseases. This bill removes non-medical exemptions to the decades-old immunization requirements for the institutions where our children spend most of their waking hours. It also tightens the exemptions for healthcare workers, many of whom are here today, and daycare employees. As a matter of practicality, it grandfathers students who are both currently claiming a non-medical exemption and enrolled in an individualized education plan. The bill further calls on both the Departments of Health and Human Services and Education to amend their rules to ensure full implementation of these changes. These changes are necessary if we want to prevent headlines from Washington and New York from appearing instead on the front page of the Bangor Daily. Headlines like, and I'm quoting here, Governor Inslee declares state of emergency, cost of Washington's measles outbreak tops $1 million, expected to climb higher. Measles outbreak, one student got 21 others sick. And to be clear, Maine has felt the sting of infectious disease in recent years as well. I'm sure you will hear more about this from people behind me. These headlines and stories are particularly troubling to people who cannot be immunized, whether due to illness or age. You will hear from some of these people today, including parents of young children who, like my daughter, attends daycares where the only protection between toddlers who have established immunities and infants who do not is a half door or a few feet between tables in the lunchroom. You will also hear from parents of immunocompromised or immunosuppressed children, and possibly one or two of them themselves, not just their parents, who will never achieve the immunities needed to protect them and instead rely on their neighbors' vaccinations in order to even be in school at all. You will also hear from people who cannot receive immunizations for medical reasons. I want to take a moment here and say that in the case of medical exemptions, a physician should be able to sit down with their patient and their patient's parents and look at the best medical science available to them in order to make a determination on whether or not a medical exemption is warranted. I do not believe any group of legislators should be limiting a doctor who is practicing within the scope of their field and using the best medical judgment from doing what is right for their patient. If this committee needs to clarify this point in rules, I would consider it a friendly amendment to the bill. Before I wrap up, I want to emphasize one point. We are all in this together. We must confront this problem as a state and not just as individuals. I believe everyone who is going to testify today is doing so in an attempt to protect their loved ones or generally make their state a better place. And Madam Chair, thank you for your comments at the beginning. We are in this together, and we must approach this subject with humility and civility. In working on this bill, I've had countless conversations with people all over the spectrum of opinion on this topic. I've tried to react to concerns where I hear them, respond to criticism constructively, and incorporate new ideas into the bill. I want to sincerely thank everyone who has attempted to reach out and engage on this issue. After today, the work of crafting good policy will be in your hands. I will try to be a resource as you wrangle with the different aspects of this problem, but as you can probably guess, there are people currently in the room, and how many overflow rooms are there? Three in the other rooms, who would be better at answering some of these questions. I encourage you to focus today on the people who have traveled great distances and save questions for your colleagues like myself until the work session. We will all have more than enough opportunity to engage with each other, whether it's in the committee process or on the floor of our bodies. But today is for public testimony. That said, if you have any pressing questions, I'm happy to try to answer them, and I thank you for your consideration of LD 798 and for allowing me to present it.
Thank you, Representative Tipping. Are there any questions? Thank you for your testimony. Okay, next we're going to have Senator Black. No, it's okay. Just make sure you sign in. Go ahead.
Good afternoon, Senator Millett and Representative Caulfield and members of the Joint Standing Committee on Education and Culture's Fair. I am Senator Russell Black, and I represent Senate District 17, which is all of Franklin County and 4 towns in Kennebec. I am here to present LD 987, an act to provide autonomy to the healthcare providers to practice patient-centered care by amending the laws governing medical exemptions to immunization requirements. I submitted this legislation because I was approached by parents who feel that under current laws and DHS policies, many children who have been able to attain a medical exemption have been forced instead to use philosophical exemption option. The issue has contributed to the increase in parents refusing all vaccines and the program as whole, while filing philosophical or religious exemptions instead of allowing their children to receive those vaccinations that are medically advised. This bill provides that medical exemptions from immunization for the purposes of attendance at nursery schools, a child daycare facility, a family child care provider, or an elementary, secondary, or post-secondary school, or for employees at a certain health care facilities, is the sole discretion of students or employee health care provider. It prohibits the adoption of rules or policies related to medical exemptions, including but not limited to rules and policies that establish requirements for medical exemptions and the rules or policies requiring the review and exception or rejection of medical exemptions. This bill also removes the authority of school boards, governing bodies, or private schools, municipalities that also have stringent immunization requirements than state law. I am sure that you, just like I, have heard from a number of folks on this issue and would like to hear from many more of them today who want to share their experience when it comes to immunizations. There are folks here to testify after me who will be able to share more detail why they believe this law needs to change. I have attached, you'll find a 3-page testimony that I was going to use, but in regards to the time and the number of people, I preferred to go with a shortened version, so it is attached to my testimony. It contains a lot more information than I have talked about here. I would also like to add I oppose LD 798, and I believe parents should have the right to decide with their health care provider if a child is to be immunized or not. Thank you for your consideration of this bill, and I would say that there's probably a lot more qualified people behind me to answer any questions, but I would try to if you have any.
Thank you, Senator Black, for your truncated testimony. Much appreciated. Are there any questions for the senator? Thank you. May I ask how many legislators who are co-sponsors are here to testify? Okay. So with your permission, I'm going to invite some students that are here from Baranacook to testify because they have to get back to school. So, all right, I don't see anybody objecting, so with that, I invite Claire Holman to the podium, please. Oh, you're all coming together? Yes. Please all come together then.
Hello, and thank you for having us, Senator Millett and Representative Cornfield. As people who understand the statistics on vaccination, and as people who are in school every day, we believe in vaccination requirements. We believe this for 3 core reasons. Firstly, getting vaccinated is one of our responsibilities as members of society. Additionally, schools are a place for learning and knowledge, and by allowing people to be unvaccinated due to falsehoods and hysteria, we fail to express our value of knowledge. And finally, because schools are supposed to be a safe place.
Most people in my generation are lucky enough not to experience the horrors of diseases such as measles, polio, mumps, and rubella. Through incredible advances in science, we are fortunate to live in a world where we have access to vaccines that prevent these horrible diseases. Unfortunately, there is a group of people that are unable to get vaccinated due to immune disorders, leukemia, and other types of cancer. They depend on herd immunity. These people depend on society to receive vaccinations, resulting in herd immunity for their defense against these terrible diseases. Now, there are a growing number of people who choose to not get vaccinated for non-medical reasons. These people may believe that it is a personal choice. However, what they don't know is that many people rely on their vaccination for herd immunity. As members of our society, we need to be willing to take a minuscule risk and get vaccinated for the benefit of both ourselves and of others. In Maine schools, we teach next generation science standards in scientific and engineer practice that state, as all ideas in science are evaluated against alternative explanations and compared with evidence, acceptance of an explanation is ultimately an assessment of what data are reliable and relevant, and a decision about which explanation is the most satisfactory.
Thanks to my public school education, I have learned about vaccines, viruses, and bacteria. And one of these topics that I learned is the history of diseases and how vaccines have helped prevent these diseases from killing people. Not long ago, people died frequently due to diseases like measles, mumps, and rubella. But vaccines have proven to save the lives of many people. However, with the recent trend of vaccination superstition, these diseases that plagued our ancestors may come back. And they already have in places like Oregon. But because vaccines have helped hold back these diseases in the past, they will in the future. The public education system in which I was taught about vaccines and diseases should represent the weighing of scientific evidence, not superstition and hysteria.
As students at public school, we are used to routine fire drills and lockouts. We are accustomed to protections such as auto-locking doors to protect our safety. We have learned to live with these safeguards because we know that school is supposed to be a safe place. But despite all these protections, we have failed to keep our children safe from the dangers of disease. By allowing students who are unvaccinated for philosophical and religious reasons into our schools, we are putting the health and well-being of our children on the line. If we truly want schools to be a safe place for all students, then we need to make sure the kids who cannot be vaccinated for medical reasons are able to go to school without fear of contracting diseases such as measles and pertussis. We believe that children should not be allowed to suffer from disease because of their parents' ignorance. We believe that the safety of our schools should not be compromised by a value of belief over science. And we know that vaccinated children are the most effective way to protect our schools from harmful diseases. We all have quivered at the doctor's office while waiting for shots. And I, for one, have hurt my pride a few too many times through wearing pink camo Band-Aids. However, I continue to get vaccinated for the same reason why it is essential to have vaccination requirements in schools. Vaccination requirements are essential due to our responsibility to society. Due to upholding the value of knowledge in schools, and due to keeping schools a safe place. And for these reasons, we ask for your support on LD 798. Thank you.
Thank you very much. Would you just briefly say each of your names, please?
I'm Claire Holman from Mount Vernon.
I'm Mary Hatt from Mount Vernon as well.
I'm Malachi Vasquez Carr from Fayette.
Thank you very much. Are there any questions? Will you be submitting your testimony via email to the committee clerk? I think we would all very much appreciate to have that in our files.
Yes.
Okay.
Okay.
Thank you very much for coming today.
Thank you for having us.
Yeah, thank you.
Is Gloria here? Okay, that's what I thought. Okay, we're going to go back to our normal process, and I ask if there are any co-sponsors of LD 798 who would like to testify.
Thank you. Thank you and good afternoon. Senator Millett, Representative Cornfield, other members of the committee. My name is Jeff Gratwick, Senate District 9, Bangor and Herman. I am a retired rheumatologist, immunologist. I've practiced for 40 years. I've been in the Senate for 6.5 years now. I'd like to basically spend just a very brief time giving you context for what's coming up. I'm basically very much in favor of 794. The human immune system is a magnificent, complex, mysterious system. It's a puzzle. And all I can say is when I first went to medical school 40 years ago, you knew very little bit about it. Now we know more, but we're still in its infancy of discussing and deciding what the immune system is all about. And the first thing I learned in medical school is we live in a very dangerous world. We live in, it was put rather impolitely, we live in a cesspool. The number of bacteria, viruses out there are overwhelming, and the only way that we really can live, exist as organisms, is because of our antibody system. I've written, when you think about an antibody, you think about the National Guard. This is all tried to make in proper context, which is to say, those cells within our body which fight off bad guys. Human beings make 3 to 4 million different, very specific individual antibodies against numerous bad bugs or other bad things, i.e. viruses, bacteria, the works that exist in the world around us. In other words, we have a particular cell that is responsible for getting rid of this bad guy, another cell that's going to get rid of that one, and when they're exposed to those, they then develop and they can multiply very, very rapidly, and that's what immunity represents. That is, you have that ability to go from a very small group of cells, a very small clone, to an enormous number, be able to fight off your measles, mumps, pneumonia, whatever it be, poison ivy. Antibodies are very, very specific, and in this context, I would have you think that out there on the street, Al Capone has come back to life, and he is going down with his Tommy gun, his machine gun, and you only get one antibody against Al Capone. And if there's somebody else who looks like Al Capone, dressed in the same costume, same facial coloring, and he also has a machine gun, but it's not Al Capone, antibodies can be fooled and they can cross-react. And so we get a series of antibodies that may just get Al Capone, which is really what you're after, to take measles or whatever, or you may get one that cross-react, they're almost against Al Capone, but they have they're not specific for him, but they still will eliminate that particular bug, that particular pathogen. Antibodies remember for a very long time. It's quite remarkable. But if you're exposed to a disease, measles, mumps, chickenpox, when you're young, even when you're quite old, you still have that clone, that several cells that can multiply very rapidly, so you don't get it when you're older. Some of the bad things, some of the bugs out there do not elicit any antibody response at all. It really doesn't much matter. Our body handles them in many other immune mechanisms. Others elicit a slow response. Others can elicit, certain antibodies can be a very rapid anaphylactic reaction. And so there's a wide variety of how we respond to those bad things out there. vaccines are produced to generate antibodies that are almost specific to the bad thing, to the Al Capone lookalike, not the Al Capone itself. We don't want Al Capone here. We want to get rid of everybody else that's like that. And that's the production of when you produce these vast numbers of a particular antibody through the vaccine, they're able to cross-react and get rid of the bad bugs or things that are there. And to that point, it's very interesting, the initial vaccine was against smallpox. Smallpox prior to 1800 killed roughly 10 to 20% of all, I only know the statistics in Europe, for 500 years killed 10 to 20% of all people in Europe died of smallpox. Edward Jenner, a physician, observed that cows had a disease rather like smallpox, but not quite. There's something called cowpox. Then dairy maids, milkmaids, did not get smallpox because they had made an antibody against the particular virus for cowpox, and then they were immune. So this has a long history. It's estimated that Jenner has saved more lives than any other person in the history of the world. Vaccines should be used with caution, of course, in people with poor immune systems, bone marrow problems, etc. They should be used in caution with people with hyperimmune systems, and that's really what I've dealt with. Very active immune system, people with rheumatoid arthritis, lupus, Crohn's, diabetes, type 1, etc., and with certain allergic illnesses. So I just want to give you that basic perspective of what we're dealing with in talking about this issue of vaccines. Thank you very much and for your indulgence.
Thank you very much, Senator. I think there might be a question. Yep. Representative Drinkwater.
Just a point of order, Madam Chair. Could we open the door, maybe get a little cross breeze going?
Yeah, we have put in a request to facilities, and perhaps we could put in the request again to have a window open for us. But yes, at least the door can be opened, and that will provide a little relief. Okay, so we have 10 co-sponsors, which is 5 maybe per bill, and that's a lot. So I said I wasn't going to use the clock on co-sponsors, but I would really encourage all of the co-sponsors to get to the point, summarize. We can read your testimony if it's lengthy. Oh my God, it's okay.
Thank you. I am a co-sponsor for LD 798. Good afternoon, Senator Millett, Representative Cornfield, and other members of the committee. My name is Representative Ralph Tucker. I represent House District 50, part of Brunswick. I'm here to support LD 798, the act to protect Maine children and students from preventable diseases. Schools are supposed to be safe. Brunswick's schools are locked now to protect students from gun violence. Schools should be equally protected from viruses. Guns are easier to understand, but diseases can be just as deadly and kill far more people. For example, from 1914 to 1918 in World War I, the major powers killed 40 million people over 4 years. But in just 12 months, in 1918 to 1919, the Spanish flu killed over 50 million, including 775,000 Americans, one of whom was my grandmother's sister. My aunt had polio. My mother was a public health nurse in the 1940s when measles and whooping cough were common as well. I myself had both measles and chickenpox as a kid. And I do remember when I was having measles, I came up with 4 other boys in my house. When somebody had measles, the doctor came to visit you, and your parents were hovering over you. And believe me, it was a serious thing. It was not just treated like a cold. It was very serious. I had both of them, but I was lucky I recovered. Others are not so lucky. In the 10 years since the advent of the measles vaccine, 10 years before the advent of the measles vaccine, about 400 to 500 people, mostly kids, died every year. I grew up in a time when diseases like measles, polio, mumps, and whooping cough have become rare only because of vaccines. These diseases affected people I knew, and I had hoped the suffering of these diseases was a thing of the past. Now on the other side of the equation. As a child, my daughter Ruth had osteosarcoma, bone cancer, in her femur. She had a marble-sized tumor. She lost 27 pounds from her already thin body. Her treatment left her seriously immunosuppressed. It was a great risk and worry to send her to school. Even one unvaccinated child could bring measles into the school, and she would have had no protection. Fortunately, she recovered. Out of this, we also learned to trust doctors and the medical profession. The doctors and the CDC know what they are talking about. This is not really a scientific or medical debate. The risks and benefits are clear. The evidence is overwhelming, showing the safety and benefits of immunization. Now, I understand the issues of personal body sovereignty and libertarianism, but this has its limits. A libertarian view must give way when it puts other people at risk. Parents should have a parental right to send their kids to a school without risk of viral infection. Viral infections are far more sinister and invasive to your body than a simple injection. This bill does not force anyone to take a shot. What it does do is gives kids a school where they are safer from disease, and it gives the vast majority of parents the peace of mind of knowing that kids have an added protection, an added measure of safety. Additionally, a Maine school is often the center of the community. A breakout there affects everyone. Low immunity kids, low immunity older folks like I am now, teachers, infants, and brothers and sisters, even the community at large. Please vote for this bill. Thank you.
Thank you, Representative Tucker. Are there any questions? Thank you for your testimony. Taking other co-sponsors of LD 798.
Do you want 987 as well?
No, just 798 for now.
Okay.
I think it's confusing enough. So LD 798. Okay.
Sorry, I didn't know I was going to be coming up. I would have been ready. I have testimony, Evan. Hi, sorry, I'm totally aware that this is a public hearing and the public needs to come up here. So I'm going to make this short. Good afternoon, Senator Millett, Representative Cornfield, and members of the Education Committee. I'm Representative Patricia Hymanson. I'm a physician. I represent House District 4, which includes parts of York, Wells, Ogunquit, and Sanford. I'm pleased to be here today to speak in favor of LD 798, of which I'm a co-sponsor, an act to protect Maine children and students from preventable diseases by repealing certain exemptions from the laws governing immunization requirements. So there are two shout-outs that I would like to share with you in this issue. The first is a shout-out to STEM, science, technology, engineering, and mathematics, education, and careers. We applaud our kids, you saw 3 of them today, when they pursue these fascinating fields as I pursued them growing up. We depend on our kids, their smarts, their hard work and commitment to navigate the world of medicine and public health when they go into these fields. We should listen hard to them. These fields are demanding and complex. We encourage our kids to be our future and to make all our lives better. They have, and vaccines are one product of a STEM education. The other shout-out is to the families in the schools I represent in District 4. These are the schools of York, Wells, Ogunquit, and Sanford. According to the Maine CDC, the great majority of the elementary schools in my district have vaccination rates over the targeted 95%. And one, the Lafayette School in Sanford, has a vaccination rate of 100%. Likely you won't meet many of those parents today who I represent, who vaccinated their children, but as their representative, I'm here to tell you how proud I am of them. I also wanted to mention that we had we had a bill to take away the philosophical exemption in the 127th that came to our committee. I'm co-chair of the Health and Human Services Committee. We voted ought not to pass because vaccine rates were generally high enough. But that's not the case now. Washington State has a public health emergency which was declared by the governor. 800 children are now kept out of school because they're not vaccinated. We were told this by a veteran legislator from Washington State who was here yesterday. The World Health Organization has 10 threats to global health in 2019. One of them is vaccine hesitancy. And lastly, my mother had a sister, Ruth, who died from influenza, the flu, in the 1918 flu epidemic when she was 3 years old. I've wondered if I would have known my Aunt Ruth if vaccines had been around. Thank you.
Thank you, Representative Hymanson. Any questions? Thank you for your testimony. Continuing with LD 798 co-sponsors.
Good afternoon. Senator Millett, Representative Cornfield, and distinguished members of the Joint Standing Committee on Education and Cultural Affairs. I am Representative Genevieve McDonald of Maine House District 134, and I am testifying before you today as a co-sponsor in favor of LD 798. Immunizations are safe. Immunizations are effective. Immunizations protect public health and prevent the reintroduction of infectious diseases into our schools and communities. Immunizations protect our most vulnerable citizens. My children are part of the vulnerable population that depends on herd immunity. I have the infants that are on the other side of the half door. Vulnerable populations should be able to depend on safe schools and safe communities. Maine has the 7th highest non-medical exemption rate in the nation. To put this in perspective, as of March 12, 2019, Clark County, Washington had 71 confirmed cases of measles. Of those infected, in 62 cases, the patient was unvaccinated, and in 7 cases, vaccination status could not be confirmed. In 2018, the average philosophical and religious exemption rate for kindergarten-age students in Clark County, Washington was 6.7%. The average philosophical and religious exemption rate for kindergarten-age students in Hancock County, Maine is 8.7%. Please find the attached data from both the Maine CDC and Washington State Department of Health. Included are the immunization exemption rates for individual schools in Hancock County. There are schools experiencing non-medical exemption rates as high as 33.3%. This is unacceptable. The World Health Organization made headlines this year for declaring vaccine hesitancy a threat to global health. With exemption rates this high in Maine, it is not a question of will an outbreak occur, it is a question of when. And it is already happening. Maine has the highest rate of pertussis in the nation, a vaccine-preventable infectious disease that can be fatal to infants and newborns. This morning, I received an email from a constituent urging me to support this legislation. Her son contracted pertussis and has been fighting the illness for 5 weeks. She is a family nurse practitioner with both personal and professional experiences witnessing the impacts of vaccine hesitancy. In 2000, the federal government declared measles eliminated in the United States. In 2018, there were 349 cases. As of March 7th, 2019, there are already 228 confirmed cases, one of which is in New Hampshire. Maine is vulnerable, not only to measles, but to the reintroduction of a number of preventable infectious diseases. Rubella and polio have also been declared eliminated in the U.S., but for how long? Oregon just confirmed its first case of pediatric tetanus in 30 years, and that 6-year-old little boy suffered greatly. This proposed legislation isn't forcing anything except a choice that parents who choose not to vaccinate already make. The choice is still theirs, only now they will have to face the consequences of their choices along with the rest of us. When someone chooses not to vaccinate, it does not impact only their child. I spent 3 weeks at home last year after an outbreak of varicella at my children's daycare. That was not my choice. Why would we choose to allow a segment of the population to reintroduce preventable infectious diseases into our schools and communities? I support this legislation as a means of protecting public health and keeping our most vulnerable citizens safe. If someone's philosophy does not align with that, they are welcome to choose an alternative education for their child. When SB 277, the legislation that eliminated philosophical and religious exemptions in California schools, went into effect, immunization rates increased. I have spoken with parents who are willing to comply should this legislation move forward, but are concerned about their children being able to either remain in or to start school. I encourage the committee and the Department of Education and the Department of Health and Human Services to develop a reasonable time frame for compliance. I urge you to please support LD 798. Thank you for your consideration.
Thank you, Representative McDonald. Are there any questions? Thank you.
I am Linda Sanborn, State Senator from Senate District 30, representing Gorham, Scarborough, and Buxton, and I'm going to make this really easy. I'm just going to hand out my testimony. You know where to find me. I strongly support this bill.
Oh, Senator Sanborn, thank you. I'm just saying, legislators, that was excellent, because we do know where to find you.
Chairwoman Millett, Chairwoman Cornfield, honorable members of the Joint Standing Committee on Education and Cultural Affairs. My name is Ryan Fechter. I represent House District 11, which is part of Biddeford, and I'm actually here today to testify on behalf of my grandmother, so I'm not presenting my own testimony, but I did want to get this in.
I'm so sorry. Representative Fecto, are you a co-sponsor?
I don't remember if I am or not. No,
You're not.
I'm not. Okay.
And I'm only taking co-sponsors right now.
Then I will just submit the testimony on her
If you
behalf.
don't mind.
I encourage you to read it.
Thank you. We will, for sure. Okay, so are there any other co-sponsors of LD 798?
Did you check Diane Day?
You are not.
I am not. Okay.
Nope.
So I will
Okay. We will be taking legislators in support or in opposition later, but right now we're just taking co-sponsors, okay? Okay, so co-sponsors of LD 798. Okay, now we're going to move on to co-sponsors of 987.
Good afternoon. I am Representative Beth O'Connor. I represent House District 5, which is Berwick and part of North Berwick. And
do you have testimony to?
I do have testimony. However, this testimony is written testimony for 798. I can give that now, or I can just testify on one. I can keep it under probably 3 minutes.
Go with, you can have both.
Wonderful.
Yep.
So as far as 987, Russell Black said everything I wanted to say. He was spot on. I support that bill 100%. And in addition, I am here to testify on 798, which I am testifying in opposition to. And I'd like to thank the committee for this amazing turnout and hearing and for hearing us all. So I am not anti-vaccination. I'm anti-government force of my body or anyone else's, and I'm certainly opposed to the usurpation of my parental rights. On February 26, 2019, the following statement was made. The Association of American Physicians and Surgeons, AAPS, strongly opposes federal interference in medical decisions, including mandated vaccines. After being fully informed of the risks and benefits of medical procedure, patients have the right to reject or accept that procedure. The regulation of medical practice is a state function, not a federal one. Government preemption of patients or parents' decisions about accepting drugs or other medical interventions is a serious intrusion into individual liberty, autonomy, and parental decisions about child rearing. To take it further, Dr. Ron Paul was clear when he said, "The rise of mandatory and forced vaccination legislation should send a chill up every American's spine. The government can force you to accept any kind of medicine and inject you against your will. It is totalitarianism at its worst. This egregious form of state power is metastasizing." I concur with both statements 100%. In addition to a reduction of our liberty, the risk-benefit ratio varies with the frequency and severity of disease, vaccine safety, and individual patient factors. These must be evaluated by patient and doctor, not imposed by any government agency. Vaccines can be risky as recognized by the U.S. Supreme Court and by Congress. The Vaccine Injury Compensation Program has paid out over $4 billion in damages despite the extreme difficulty of vaccine injured to collect funds. Huge awards are awarded. The damage may be so devastating that most people would prefer restored function to a multi-million-dollar damage award. I'm often shocked at the hypocrisy of those who would force government-mandated vaccinations on any individual and strip them of their choice, yet so vehemently protect a woman's choice for abortions. It's immoral and unethical that anyone would think they could have it both ways. Thank you. I'm happy to take any questions.
Thank you, Mary, very much. Representative Turner, are there any questions? O'Connor, so sorry. O'Connor, Representative O'Connor.
We're both Beths.
That's what it was, exactly.
Thank you.
Thank you. And you have testimony for LD 987 as well? Is that true, Representative O'Connor? Yeah.
Well, do you want me to? I can.
No, I'm just saying, did you have any to have it passed out?
No, but I will.
Okay, great. Thank you. Representative.
There's no sign-in sheet here for sponsors.
Will note.
Okay.
Thank you.
Thank you. So, Senator Millett, Representative Cornfield, and fellow committee members. I am Heidi Sampson, representing House District 21, Alfred, Limerick, Shapley, Newfield, and Parsonsfield. I come before you as a co-sponsor to LD 987, an act to provide autonomy for healthcare providers to practice patient-centered care by amending the laws governing medical exemptions to immunization requirements. Maine law requires DHHS to write the rules surrounding medical exemptions, and those rules are so restrictive and out of date that they have rules that cannot be followed for some families. The vaccines required are no longer available in single doses, as would be required for compliance, and address vaccines that are no longer administered in the United States. In fact, any rules restricting medical vaccine exemptions will be out of date by the time they are published. Are physicians supposed to wait for the state to catch up with the science every time a new paper is published? Our understanding of the functioning of the human body is changing rapidly, and the state of Maine cannot act quickly enough to make the appropriate change to the exemption rules as our understanding grows. As it has been noted, under current rules, children who develop a seizure disorder due to MMR, mumps, measles, and rubella, cannot have a medical exemption to the pertussis vaccine, even though it also causes seizures. CDC says that siblings of children with immunodeficiencies should not be vaccinated with MMR, but no medical exemption can be written for that sibling. There are no medical exemptions for children who have genetic predispositions to vaccine adverse reactions, or who have had siblings who have been injured or killed by vaccines. Family history and genetic risk factors for vaccine adverse reactions are not even mentioned in Maine's medical exemption rules. If we trust medical professionals to decide who can be safely vaccinated, why do we not trust those same medical professionals to decide who cannot be safely vaccinated? I ask you, as my committee members, to consider for a moment being a parent forced with this reality. Many are already living a life with an injured child. Without this bill, parents will be asked to play Russian roulette. The weapon? A vaccine. The reality is of profound significance and can have disastrous consequences. Please allow healthcare providers and parents to have the autonomy to make the appropriate decisions for their patients' welfare. Where there is risk, there must be choice.
Thank you, Representative Sampson. Are there any questions? Thank you for your testimony.
Thank you.
Good afternoon. I am a co-sponsor of Senator Black's bill, and I do concur with Representative Sampson's testimony. I am here also to testify in opposition to 798. Senator Millett, Representative Cornfield, members of the Committee on Education and Cultural Affairs, my name is Robert Foley, and I represent the citizens of Senate District 34, which includes the towns of Kennebunk, Wells, North Berwick, Lebanon, Acton, and part of Berwick. I'm here today to oppose LD 798 and any other bills related to changes to the current laws regarding philosophical, religious, or personal exemptions for parents choosing to not immunize their children or to immunize them under a different protocol. My wife and I were parents of a 2-month-old daughter who died 32 years ago, just 36 hours after receiving her first set of vaccinations, including the DPT shot. There's not a person in this room or in these halls who will ever convince us that those shots did not play a significant and vital role in our daughter's untimely and unwarranted death. Our daughter was a healthy, vibrant baby weighing 7 pounds 11 ounces at birth, receiving an APGAR score of 9 and exceeding all growth markers for her birth until her death. Her doctor the day before she died remarked how well she was doing in comparison to the standardized growth charts, where she registered above the 90 percentile. After her death, her doctor secured the remaining quantities of vaccine serum he had for the possibility of testing the vaccine serum for potential imperfections. Inquiries to the State Medical Examiner's Office, the Maine CDC, and Federal CDC regarding the testing of the serum were rebuffed as unnecessary and potentially problematic for the vaccination regimen being implemented throughout the country. We were told on several occasions that no good would come of our pursuing the testing we were requesting. It was time for us to move on. We were left with the status of diagnosis: no known cause of death, sudden infant death syndrome. A recent decision at the Vaccine Injury Court of the United States in Bowman versus HHS, a judge ruled, in this case, I have concluded, after review of the evidence, that it is more likely than not the vaccines played a substantial causal role in the death of JB, without the effect of which he would not have died. The role of inflammatory cytokines as a neuromodulators in the infant's medulla has been well described and is likely the reason for a significant number of SIDS deaths occurring in conjunction with mild infections. My wife and I were not informed by the state of the federal CDC that the Vaccination Injury Court even existed for our appeal of the testing of our daughter's vaccine. And let me be clear, we went after vengeance. We were after truth. If vaccines are so safe, why has the federal government exempted all manufacturers of any liability, and why has the vaccine court paid out over $4 billion in damages? Fortunately, my wife and I had 2 other children after our daughter's death, both similarly healthy, with similar growth progressions, but neither of them had vaccinations so early in their lives, and neither had the DPT shot, just the DT. We did not start vaccinations until after 6 months, and never multiple injections at any one time. As a result, my wife and I used the philosophical exemption requiring our children to be vaccinated under different protocols. We were very, very diligent parents. Our doctors understood our concerns and respected our philosophical feelings and beliefs. We never put our children or anyone's children in danger by exercising our rights as parents. Every school they attended from pre-K all the way to college equally respected those rights. This bill will prevent many students from attending Maine schools. Many foreign students from Europe, Japan, Asia, the Middle East, and beyond are not currently exposed to the same vaccination regimen required by this law. In fact, many countries do not even require vaccinations. Many immigrants coming into our country have no vaccination histories, and yet we let them into our schools without the same questions. I do not wish a child's death on any parent. That pain is with me today. I only ask that people have some compassion for the wrenching decisions that my wife and I had to make as a result of our daughter's untimely death. They were not easy decisions and were not made without a great deal of contemplation, consultation with our medical providers. Unless you believe that healthy babies simply die for no reason, I ask that you respect and understand the difficult decisions that parents who have had a tragic vaccination reaction like ours have faced. If there are any changes to the statute that needs to be made, I believe a definition of what a philosophical exemption means should be changed, as there is no definition under law. And I put a potential definition. A person who has experienced a negative reaction to or even the death of a child as a result of a routine vaccination shall be afforded a philosophical exemption from the standard protocol of vaccinations supported by a statement from the attending physician of the child or a subsequent child. I thank you for your time.
Thank you, Senator. Do you have any testimony in support of the bill that you are a co-sponsor on?
I will get that to you.
Thank you very much.
Thank you.
Co-sponsors of LD 987.
Senator, with all those folks in the other rooms, I am going to read this. I'll read more quickly than usual to try to keep the flow of things going today. Thank you. Senator Millett, Representative Cornfield, and members of the committee. I represent Knox County except the town of Washington. And I'm here as a co-sponsor of 987, and I only want that bill if you pass 798. Otherwise, we don't need it. This covers it, and we have a good program already. There are three basic reasons for individuals or their parents or guardians to refuse vaccinations. There have always been religious objections which the government has chosen to honor. If a religion practices beliefs that come into conflict with laws of the land, the government has to decide if the religious objections are valid. In the case of refusing vaccinations, this has been settled and is allowed. Since this is the case, no person, business, or educational institution should be able to discriminate unilaterally. When the ingredients of vaccines became public information, many people began to question the benefits versus the risk. It turned out that manufacturers were using known poisons in vaccines, and that a previously unknown disease, now well known as autism, began to appear after severe reactions in children who were vaccinated. While there are different causes for autism, vaccine injury is the primary one. The rates of autism in the 1970s was 1 in 10,000. Just 3 vaccines were required by the CDC in '62. The autism rate is now 1 in 36 children, paralleling the increase in vaccines to 38 by the age of 5. The manufacturers of the vaccines have resisted efforts to make changes even as the number of vaccines required before the age of 2 years has grown to over 20. This gives children a dose of mercury 80 times higher than the accepted safe level. This and other information about the cycles of disease opened up the philosophical exemption that allowed parents who were concerned about their children's safety and well-being to opt out of the mandated vaccination schedule and pick schedules that are much safer. When people follow the law and make choices that are theirs to make, there can be no justification to allow fear to condone discrimination. While the theory of herd immunity has not been proven, herd mentality has. The experience with vaccines has not given cause to allow discrimination in education based on herd mentality. If we are to look at the herd mentality further, the proponents of this bill say that they need a critical mass for the effects to work. They say that number to ensure herd immunity is 95%. Even with the exemption system in place, Maine already has a 95% vaccination rate in children in a certain part. This alone is a good reason to continue to allow the exemption, but further examination shows that the ongoing recommendations for maintaining this herd immunity are not being met. The life of a vaccine is finite and needs to be re-administered, according to the drug companies. This means the vast majority of adults in the United States, around 150 million, are not vaccine protected from these diseases. So the schedule for vaccinating adults is seldom followed, leaving us not even remotely close to the herd immunity in the U.S. And yet we're not having outbreaks of the diseases that are at the heart of the sponsors' fears. This leaves room for the continuation of exemptions so that even folks who choose vaccination can choose those known to be safe, free from toxins, and administer them on a schedule that allows the health of the child to be maintained. The debate about vaccines has been one-sided because of both the amount of money that the manufacturers have to spend and continue to make, expected to be $60 billion by 2020, one more year, and the lack of adequate science and studies on safety. Unlike any other drugs, these manufacturers have been exempted from the responsibility for their product, and that liability has been put on the backs of taxpayers. The Vaccine Compensation Board has paid out over $4 billion in vaccine injuries since it was put into place. The reporting of vaccine complications by doctors is voluntary. The Harvard study found that fewer than 1% of vaccine adverse events are even reported, therefore leaving this compensation barely representing the injuries that exist. As for the issue of safety, the U.S. Department of Health and Human Services has spent tens of billions of dollars promoting and purchasing vaccines, yet there have been no funds allocated to study what injuries are caused by vaccines. Usually this would be a minimum requirement for allowing the product or drug to be used, but in this case there's no push by the government for better data. DHHS's claim that vaccines are safe comes from studying just one vaccine, MMR. Dr. Thompson, a scientist at the CDC for almost 2 decades, described in 2014 how the CDC concealed a finding that healthy children who receive the MMR vaccine may be 8 times more likely to develop autism than those without the vaccine. The CDC has not addressed the study which found that 300% increased rate of autism among newborns getting the Hep B vaccine at birth versus those who have not. The list of concerns with vaccines and toxins includes aluminum used in them is long. Some of the conclusive, in quotation mark, studies were done over only a period of 5 days after vaccination stopped. None of their studies have included a control group. Members of the board at the U.S. Food and Drug Administration that licenses vaccines have pharmaceutical connections and have made millions on these vaccines. 3 out of 5 FDA advisory members who voted to approve the rotavirus vaccine had financial ties to pharmaceutical companies. There are currently over 1,000 pharma lobbyists in Washington, D.C., compared to virtually no vaccine safety lobbyists. After seeing an alarming decrease in the health of the children they vaccinated and the drastic increase in autism, some doctors have created a safer vaccine schedule. Dr. Paul Thomas, a Dartmouth-trained physician, has vaccinated over 2,000 children with this protocol and has had no autism. There normally would be 50 cases in 2,000. We need to allow parents a choice to pick safer options for their children. For all these reasons, parents are deeply concerned about a lack of adequate science and studies done on the vaccine safety, and the vast increase in autism and numerous other conditions that have coincided with increases in vaccine schedules. Many, while not opposed to vaccinations, are unwilling to turn their choice and protection over to this convoluted system until these issues are addressed. The life of their child depends on this choice. The right to free speech is another consequence of the tobacco playbook that is being used against those who would have a choice about what and when any medication is put in their bodies. The social media platforms that we count on for open discussions are being censored based on the attempts driven by drug companies to stop the questioning. They are using the same tactics that the tobacco companies use to deflect from the fact that their product causes heart disease, of which they are well aware. Those tactics included distract, redirect, and delay, tactics evident in every aspect of the campaign by Big Pharma to ensure their profits. How many of these assurances do you remember? In all of the following cases, assurances were given after the effects of the particular problem were already known by the company or government agency responsible. Lead in the water supply of Flint, Michigan. Asbestos causing mesothelioma. Brain damage from lead paint, heart attacks from Vioxx, birth defects from thalidomide, leaks from silicone breast implants, destruction of the ecosystem from DDT. Don't throw our children out of school and our educators out of work until the real issues regarding vaccines are required to be studied. Please continue to allow exemptions so our residents can choose a safe schedule of vaccination based on the health of themselves or their children. Let's send a strong message to the drug companies that they are here to serve us, not we here to serve them. I urge you to vote ought not to pass on this bill and protect the personal freedoms this country stands for. Thank you very much.
Thank you, Senator. Do you have testimony in support of the bill that you were co-sponsor on?
No, would you like some?
I think that would be good because I do seem to see a trend here. I was inviting co-sponsors to testify on the bills that they were co-sponsors of, and that's been a little taken advantage of. But at this point, it's what's... well, okay. Are there any co-sponsors of LD 987 who would like to testify on 987?
Would you like me to combine my testimony?
That would be good, yeah. Mm-hmm.
And I will skip the formalities just in the reference of time. Thank you for allowing me to testify. I will be testifying in opposition of 798 and in favor of 987. I was much like
you
other...
introduce yourself, I'm sorry.
Oh, I'm sorry. I'm Senator Stacey Guerin, Senate District 10. I live in Glenburn. I was much like other young mothers when I took my first child in for a doctor's appointment and shots. I truly gave it little thought at all. Children get shots, cry, and go home happily. That was my mindset. My view of vaccines changed that day when my son Gabriel had a seizure after the DPT shot was administered. Although we did continue to have vaccines, we were selective and had the vaccines well spaced for Gabriel and his subsequent 4 brothers. We followed our pediatrician's advice and had no further pertussis vaccines. Vaccines are biological products manufactured by for-profit pharmaceutical corporations. Like other pharmaceutical products, vaccines carry a risk of injury or death, which can be greater for some people than others, and often doctors cannot predict who will be harmed. One-size-fits-all vaccine policies and laws which force you to risk your health or your child's health without your voluntary informed consent and with the threat of punishment for declining a vaccine violates human rights. It is important to protect civil liberties, including the freedom to exercise voluntary informed consent to medical risk-taking. Without the legal right to protect autonomy and bodily integrity, without the legal right to freedom of thought, speech, conscience, and religious belief, we are no longer free. Please preserve our current exemptions and allow patients to follow their physician's advice. I would be happy to take any questions.
Thank you very much, Senator. Are there any questions?
Thank you.
Thank you very much.